Hi, this is Tonya Baines. I am an advanced practice registered nurse student for Franklin University, and I am working on a case scenario for Devon Jones, who is a 40-year-old African American male with a long-standing history of uncontrolled hypertension. He also has a family history, lost both parents to hypertension. His mother also had diabetes. He drink. He's a cop, which is he has a stressful job. Eat foods high in fat, carbohydrates, and sodium. So, what is hypertension? It is an illness that causes the cardiovascular system to dysfunction and make the heart beat faster and harder. Blood pressure greater than 130/80 for a long period of time should be addressed because it could be hypertension. Hypertension affects 46.6% people in the United States, and that's pretty huge. And there are three types: primary, secondary, and complicated. Primary hypertension is what we call the silent killer. And so what I would say to Mr. Jones is it's a silent killer. You may or may not have symptoms. Sometimes your only symptoms may be when it's gotten really bad and you could pass out or do something. So at this stage, you need to be watching for symptoms. Secondary hypertension is just what it is, secondary to another disease. So if you got diabetes, and I would have him be checked for diabetes because he does have a family history. His mom passed from diabetes. He should be checked for diabetes. You can get it from kidney disease, heart disease, endocrine diseases such as hyperthyroidism. Those are also causes. So being proactive with treatment is key in reducing symptoms, and I want him to prevent complications. So, what is complicated hypertension? Oh, that's the big one. Complicated hypertension is blood pressure that is greater than 180/120. 180/120 or greater. You may or may not have symptoms, and to think about that, that's scary. So if you do have symptoms, it might be something just like a mild headache that is usually ignored. However, complicated hypertension can lead to heart attacks, strokes, TIA, which is transient ischemic attacks, and permanent disabilities or death. The pathological effects of sustained complicated hypertension. If hypertension is left untreated and undiagnosed, it's constant pressure on your arteries and your walls that could lead to, again, a transient ischemic attack. Transient ischemic attack, and I'll use TIA to shorten this, is typically, it mimics a stroke, but in the nature and the severities are different. A stroke a stroke it causes complete blood flow to the brain, where a TIA causes a temporary stop of blood flow to the brain. Treatment for Mr. Jones would be to see a provider and be referred possibly to a cardiology provider like an NP that works in cardiology. The plan of care should include blood pressure medication like ACE inhibitors and beta blockers. ACE inhibitors or beta blockers block the beta receptor in your heart and slow your heart rate down. Follow-up should be a part of that. Targeted blood pressure should be 180/120. You want to log that. Decrease alcohol consumption, 30 minutes of cardio exercise 3 to 4 times a day, and decrease in salt and foods high in fat. Thank you.